Krishna Udayakumar joins me now. He is a global health innovations and policy reforms specialist. Thank you so much, Krishna, for joining us today. A lot to get to, and unfortunately, dire situations all around the world. Let's start with Brazil and India. Now, of course, with the second and third highest number of cases in the world behind the United States, do you expect that trend to continue? And what will it take to turn things around in those two countries?
Unfortunately, there doesn't seem to be an end in sight in either Brazil or India because the trend lines are going in exactly the wrong direction. In Brazil, we're starting to see some of the worst outcomes in the world in terms of looking at 3,500, 4,000 deaths a day and going up. The health system is already overwhelmed, and we've seen reinfection rates in places like Manaus also be concerning, especially with this new P1 variant that seems to be more aggressive. So what we really need to see are much stronger public health measures and a ramp up to the extent possible in terms of vaccinations. The same in India, where in the hotspots tend to be a small number of states, but a huge number of cases that we're starting to see there. So we've got to figure out a way to increase the supply of vaccines for hotspots around the world, especially India and Brazil. And we have to find ways locally that other public health measures, whether those are lockdowns, social distancing, and the like, can also be put in place as temporizing measures.
And let's turn to Europe now and the issues with that AstraZeneca vaccine that's being linked to some rare blood clots. How do you think this setback will set back vaccine efforts across the continent there?
Yeah, it's quite unfortunate, both in Europe but also for the world. The AstraZeneca Oxford vaccine is really, of all of the vaccines out there, the one that globally we've bet on the most. It's supposed to have manufacturing capacity of about 3 billion doses this year. And if you look at COVAX, the mechanism that's providing access to vaccines for much of the low and middle income countries in the world, most of the vaccine supply they're counting on is the AstraZeneca over the coming 3 to 6 months as well. So the lack of confidence, the lack of consistency in policy approaches across Europe are not helping matters. With all of the data that we have, this still appears to be a very good vaccine. There does seem to be some link to very rare clotting disorders, but that should be put in the context of what the risk-benefit ratio really is. And the less confidence we see in good vaccines like this one, the less we're going to see in terms of how many people around the world, and certainly in Europe included, are confident in taking that vaccine.
Krishna, we just have a short time left. Finally, here in the U.S., we have, more people being vaccinated, about 40% of adults at least partially vaccinated. Yet we have these COVID cases still trending upward. What do you attribute that to, and what will that take to turn things around here in the United States?
Yeah, we are right on the precipice of what might become a fourth surge here in the U.S. as well, with hotspots, as we just heard, in places like the upper Midwest. Unfortunately, we're not anywhere close to reaching herd immunity through vaccinations. We've done better than any other country in the world in getting vaccines out so far, but we're not there yet. And so the risk is that we start to get fatigue. We start to think we've turned the corner a few months before we really have. We're going to have enough vaccines to cover everybody, every adult, in the coming probably 8 to 12 weeks. And so we just have to sit through this a bit longer and make sure that we're taking all of the public health measures to get through the acute phase of this pandemic.